My name is Monica Marasco, and today I will be talking about the skeletal system. Here I have the list of bones that I'll be talking about on the front and back, as well as the bone types. Firstly, the skeletal system is composed of the skeleton, ligaments, and other components that stabilize and interconnect all the different parts of the system. Like I briefly mentioned, there are 7 classification types of bones based on the shape. The first is sutural, which are oddly shaped bones, relatively thin. They're usually found in the bones of the skull, such as the occipital bone or the frontal bone. Next, we have flat bones, which are pretty thin. I'm looking up at the scapula on my skeleton because that's an example of flat bones. They have roughly parallel surfaces of compact bones. Next are the long bones, which are long and slender, as the name suggests. They have a diaphysis, 2 metaphyses, and 2 epiphyses, as well as a medullary cavity. The femur is a good example of a long bone. Next, we have sesamoid bones, which are small, round, and flat. The patella is a good example of this. Next are the irregular bones. The irregular bones are oddly shaped. They have grooves, ridges, rough edges, and the vertebrae are good examples of irregular bones. Next are short bones, which are flat. It's kind of like a sandwich of compact bone on the outside and spongy bone on the inside. They're pretty small as well because they're found in the carpals and the tarsal bones of the hands and feet. And finally, we have pneumatized bone, which is has a lot of pockets, kind of hollow, such as the ethmoid. So next, I will be getting into the bones of the skeleton. So firstly, I'll start off with the axial skeleton. The axial skeleton is the skull and the thoracic cage and the vertebrae. So starting with the skull, again, I'm reading off the bones that I wrote down. We have the nasal bones, which are right here. I use this pen. Then we have the lacrimal bones in here, the inferior nasal conchae, which are right in here, and then the maxilla, the zygomatic bones, the temporal bones, which are right here on both sides, the palatine, which if you open his mouth and it's kind of toward the back in there, I can't really show it. And then you have 3 bones in the ear, the malleus, the incus, and the stapes. And then we have the frontal bone right here, and then the ethmoid. I have to take this off and kind of take him off this and lean him over. The ethmoid is this little bone structure right here. And then we have the sphenoid, which is right here. And then the vomer, which is right up in there. And then the mandible, and finally the occipital bone right here. Moving along to the torso, we have ribs 1, 2, 3, 4, 5, 6, and 7, and then ribs 8, 9, and 10, which are false ribs, and then ribs 11 and 12, which are floating ribs. We also have the sternum right here, which is made of the manubrium, the body, and then the xiphoid process. Flipping this guy around, we're going to look at the vertebral column. Right here is the cervical vertebrae 1, also known as the atlas, and then cervical vertebrae 2, which is known as the axis, and then C3, 4, 5, 6, and 7. Next, we move on to the thoracic vertebrae. Thoracic vertebrae 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Then finally, we move into the lumbar vertebrae, which are 1, 2, 3, 4, 5, right here. This right here is the sacrum, and then this right here is the coccyx. So that is the full axial skeleton. Let's see if I can move this guy here. Okay, moving on to the appendicular skeleton. Starting with the upper extremity right here, we have the scapula, and then the clavicle. And then we have the humerus, the radius, the ulna, and then we have the carpal bones, which are 8 bones. I'm going to move this up here. The carpal bones right here, we have the scaphoid, then the lunate, then the triquetrum, and then the pisiform. And then we have the trapezium right here, the trapezoid, the capitate, and then finally the hamate. Now, moving on to the metacarpals, there are 1, 2, 3, 4, 5, starting with the thumb as 1 and then the pinky as 5. The pollex, which is the thumb, only has a distal and a proximal phalange 1, and then the rest of the fingers have proximal, medial, and distal phalanges. So proximal, medial, distal phalange 2, proximal, medial, distal phalange 3, proximal, distal, medial phalange 4, and proximal, medial, distal phalange 5. And then finally moving on to the lower limb. Right here, I'm going to move this up. Right here we have the hip bone, which is the ilium, then the ischium, and then, the ischium right here, and then the pubis. Then we have the femur, the patella, the tibia right here, and then the fibula. And then moving on to the tarsal bones, we have the calcaneus right here, the talus right here, and then we have the navicular, the cuboid, and then the lateral cuneiform, intermediate cuneiform, and the medial cuneiform. Then we have metatarsals 1, starting with the big toe, 1, 2, 3, 4, 5. And like the thumb, the big toe only has a distal and a proximal phalange 1, and then it goes distal, it goes distal, middle, and proximal, middle, distal phalange, proximal, middle, distal phalange 3, proximal, medial, distal phalange 4, and then proximal, medial, distal phalange 5. Those are the bones of the appendicular skeleton. And as a future nurse, I think a lot of my clinical application will come from dealing with broken bones. Like the book showed, there are a lot of different types of fractures, different sprains. If I were to work in the ER, I'm sure I'd see a lot of people coming in with broken bones, sprains, torn ACLs, all of that. We're very rough and tough on our skeletons. And I know there are a lot of clinical applications that I will probably see, not only in clinical rotations, but once I establish myself as a nurse.